Good morning to everyone. So here, am I audible? Am I audible?
Yes, ma'am.
Okay. So today I will introduce one of other speaker for our summer school. So I'm excited to introduce Dr. Kirubashini, uh, who is a today's speaker, and she is graduated from the RVS Homeopathic Medical College, where she studied from 2010 to 2016. She has worked at Swara Homeo Clinic and has been a part of Swara Homeo Gurukul since 2016. So even teaching there after completing her teaching training course in 2019. In July 2019, she started her own clinic. The name is Viswanath Homeopathic Homeo Clinic. She has learned a lot from her mentor, that also my mentor, Dr. Shekhar Algundgi sir. So now let's give a warm welcome to our today's speaker, who will share you her valuable experience with us today. So welcome, ma'am, and we all are very excited to learn from you, ma'am. So please welcome, and the dais is yours, ma'am.
Thank you so much, ma'am. Thank you so much for the warm welcome. Before I could start the session, I would like to thank Vidhyadeep University, the management, principal sir, and the whole staffs and students, those who are all the part of this webinar. I thank to each and everyone, those who are the part of this series. Next, I would like to give my gratitude, and I'm always thankful to my guru, Dr. Shekhar sir, and to all my Swara family members. So lots of gratitude and thank you so much to each and everyone. With this quote, I would like to begin the today's session. Ma'am, hope PPT is visible and I am audible. Ma'am,
Yes, ma'am. Yes, ma'am. PPT is visible, and you are also audible, ma'am.
Thank you, ma'am. Thank you. So I would like to begin the session with this quote, which will correlate to the for today's topic, which we are going to discuss. So injury generally teaches to appreciate every moment. I have had share of injuries throughout my career. It's humbling. It gives you perspective. No matter how many times I have been hurt, I have learned from that injury and come back even more humble. An injury is not just a process of recovery, it's a process of discovery. I learned that pain isn't the whole problem and the absence of pain is the whole situation. I know that if a miracle have occurred and my pain have gone, everything would not be fine. I would still need to deal with the damage caused to myself and others because of my chronic pain. So, pain teaches a lot in life, which will help us to grow in life. So, our topic for today's session is understanding the materia medica of Compositae family. Are you all ready to unwind this journey of exploring the Compositae family? If yes, please type S in the chat box. Yes. So Compositae family is also known as Asteraceae family, Daisy family, or Sunflower family. So in this session, first we are going to give some introductory points for the Compositae family. Then we are going to deal with few remedies with their metramedica and repertory understanding. And then we are going to deal with we are going to study a case which has been cured via one of the remedies of this family. So this is going to be the next 2 hours what we are going to go through. So first set is introduction. The word Asteraceae means star in Greek, referring to the appearance of some family member as a star surrounded by rays. In this flower also we can see it's like a ray spreading out. The petals are like a ray spreading out. The name daisy, widely applied to the members of this family, is derived from the old English name of daisy, which means day's eye. This is because the petals open at dawn and closes at the dusk, like the sunflower. It is one of the largest widely distributed throughout the world, consisting of highly evolved dicotyledonous plants. They are annual or perennial herbs, shrubs, and rarely trees. There are 900 genera and 1900 species of this family. So this family is one of the largest family, and this family has the more remedies which have been proved, fully proved or partially proved. Around 60 remedies we have in this family. So now the traditional uses. These family plants are traditionally mostly used to in the treatment of diseases and pain is the beneficial property. They are used as antioxidant, anti-inflammation, analgesics, and antibiotic activities. Apart from the pain, these family remedies have been also clinically used in many disease conditions. For example, Artemisia is used for bowel disorders, and as it has a compound of cooling effect and produces relief in the digestive issues and the other bowel disorders. And these species also helps in the relief of asthma, in piles and cough. This compound can also act as a stimulant and appetizers, helping people to maintain a proper diet. So these are all the traditionally these plants have been used for these clinical symptoms, these clinical issues. So now I would like to correlate with the aphorism to go with the further session, which is mentioned in the aphorism 273 in footnote 159, under the footnote 159. On the other hand, those extracts obtained by means of acids of so-called alkaloids of the plant are exposed to greater variety in their preparation and can therefore not be accepted by homeopathic physician as a simple medicine, always the same, especially as he persists in the plants themselves in their natural state. Peruvian bark, nux vomica, and opium. Every quality necessary for healing. Moreover, the alkaloids are not only the constituents of the plant. So whenever we read a plant remedy or whenever we read a plant family, the only main thing which we want to know about it is the active principle or the alkaloid effect in that plant. So wherever the alkaloid effects acts on our nervous system to produce those symptoms which are produced in our healthy human body. So the similar symptoms will be produced in the diseased state also. So whenever we are reading a plant family or each and every remedy of the plant family, try to read its alkaloid or active properties, how it acts on our nervous system, so that we can correlate with the symptoms produced by it, and then we can correlate with the diseased individual. So the active principle of this family is hydrocarbons, alcohols, phenol ester, acetylene, acids, esters, sugars, starch, resinol, and glycosides, alkaloids. Alkaloids are abrotin, acetylene, echinospine, lobelinidine, and senecophonine. So now we know about the alkaloids which are present in this family. So the second step is to know the sensation of this family. Thus, the proposed sensation of this family is injured. As we are talking about the pain and the injuries, most of the remedies of this family are much helpful for at the injuries, various types of injuries. At the physical level also and at the mental level also. What is the insulted, hurt, fear of being approached, touched, as they aggravate the sensation of being injured. Whenever the injury happens, if we touch, there will be an aggravation. So, they have the fear of being approached or touched, shocked, burnt, or scalded, and hence reaction of being violent, cruel, insulting, harsh, active reaction since their perception of being injured and insulted. They also have inflict that back on others. As they feel injured and they feel insulted, the same thing they show on others also. They will insult others. There is a sensitivity seen to things which are hard and sharp because of hard things and perceived as causing injury, and soft things being opposite to hard gives the soothing feeling. So as in previous sessions, we learned like what is active reaction, passive reaction, and compensation. Now we will see what is that for Compositae family. The sensation is of being injured, hurt, insulted, shocked, burnt, scalded, or scalded. Fear to be touched, hurt, approached. Their active reaction is touching, hurting others, cruel, violent, insulting, strikes. Their passive reaction is numb, anesthetic, stupor, catalepsy. And the compensation is takes all the beatings, protective of others to see they do not get hurt. So these are the sensation, active reaction, passive reaction, compensation of this family. And the remedies of this family, there are more than 60 remedies in Materia Medica. Some are being well proved and some are partially proved. They are annual plants and perennial herb shrubs with 1900 genera and 32,000 species. The appearance of single flower consists of many florets. Hence, the name of the family is Compositae. So, according to their sphere of action, these remedies are divided into these categories according to their physical complaints, according to their seat of action. So, their divisions are injury group of remedies, convulsion group of remedies, gastrointestinal or gut group, and fever group. So, the injury group of remedies are Arnica, Bellis Perennis, Calendula, Cina, Ergron, and Achiller. Convulsion group of remedies are Abrotanum, Absanthinum, Artemisia, Cina, Chamomilla, and Taraxacum vulgare. Gastrointestinal group of remedies are Brachyglottis, Cardus marinus, Cardus benedictus, Scnecio Aureus, Nephilim, Inula, Solidace, and Tulizo pharyngus and Tussilago petacitis. Then the fever group of remedies are Eupatorium aromaticum, Eupatorium perfoluatum, Eupatorium purpureum, Helianthus anus, Parthenium hysterophorus, and Phytrum parthenium. So don't get anxious by seeing these many remedies. We are not going to deal with these many remedies today. We are going to deal with the most important remedies which we are going to use in our clinical practice. This is just for the knowledge. I have listed these many remedies are there in this Compositae family, as these family consists of the more remedies, major remedies. Around 60 remedies are there, out of which this is the short form. In this, out of which we are going to deal for the today's session the following remedies. So the acute miasm, Arnica and Calendula, typhoid miasm, Chamomilla, ringworm, Taraxacum, psychotic miasm, Scnecio Aureus, malarial miasm, Cina and Eupatorium, tubercular miasm, Abrotanum, leprous miasm, Lactuca, Inula and Lapa, cancer miasm, Bellis Perennis, syphilitic miasm, Echiniaceae. So whenever we read a plant family, within the families, the remedies are differentiated by the miasms. So to learn these miasms in depth, there is an amazing opportunity coming up in the upcoming May month in Swara Gurukul workshop, which is basics, happening after 2.5 years. So to read the miasms, to learn about miasms in depth, do register for that. So up till now, is there any doubt? Because next set, we are going to deal with each and every remedies. Is there any doubt in the introduction part? Okay, thank you. We can go further. So the first remedy which we are going to deal with is Arnica montana. I think this is the common remedy which you all might have learned, but now it will be like once again we are learning with newer aspect also. The Arnica montana. Common name is leopard's burn or mountain tobacco. This was proved by Dr. Hahnemann in 1805. Miasm is acute miasm. Active principle of the alkaloid which is present in this Arnica is arsenic, which is bitter in taste, and arsenic having yellowish color. It contains arsenic acid, tannin, and insulin. So the mind symptoms, they have fear to be touched or approached of anyone, unconscious when spoken to, answers correctly, but relapses. Indifference, inability to perform continuous activity, work, morose, delirious. Nervous, cannot bear the pain. The whole body is sensitive. Says there is nothing matter with him. Sends the doctor home. Wants to be alone. Agoraphobia, after mental strain or shock. Fear of instant death. Forgetful, when he reads quickly escapes his mind. Forgets the word that he is about to say. After rage, sheds tears and makes exclamations. Violent attacks of anguish, sudden fear that rouses one from sleep at night, especially after an accident. Oversensitive to noise, sadness from injuries to head. So whenever we talk about arnica, it's mainly used for injury. So injury at the physical level. What happens when an injury at the physical level? There will be the pain, and when we touch, the area will be very sensitive to touch. They will not allow to touch that area whenever there is a injury or and there is a pain. So in a similar way, the patient's mind symptom is also like they don't want to approach anyone. They don't want to talk to anyone. And even he sends the doctor like that I am healthy only, you go to home. No need to be here. So due to this injury and hurt, and due to this sensitivity, they want to be alone. They don't want others to be approached. Because when they tell something, it hurts them. So they don't want to be approached. And whenever the injury happens at the deeper level, in the much major organs like the lungs or the heart, or the simple injury also, they might get shock. In a similar way, at the mind level also, with the hurt or with the injury at the mental level also, they feel shock. And in a similar way, these patients will gain the conscious and suddenly, and the consciousness will go off suddenly. Whenever we ask any questions to them at their delirious state, they will answer and they will go to unconscious. They will go to their delirious state again. This is due to the suddenness in this remedy, which is mainly due to the acute miasm. They are more sensitive to noises. Things happens to them suddenly in this miasm. So the physical characters produces conditions upon the system quite similar to the resulting from injuries, falls, blows, contusions. Putrid phenomena, septic conditions, prophylactic of pus infection, apoplexy, red, full face. It is especially suited to cases when any injury, however remote, seems to have caused the present trouble after traumatic injuries. Overuse of organ strains. Arnica is disposed to cerebral congestion. Acts best in plethoric feeble in debilitated with improvised blood, cardiac dropsy with dyspnea, a muscular tonic, limbs and body ache as if beaten, joints as if sprained, bed feels too hard. Affects the venous system inducing stasis, ecchymosis and hemorrhages, relaxed blood vessels, black and blue spots, tendency to hemorrhage and low fever states, tendency to tissue degeneration, septic conditions, abscess that do not mature. Sore, lame, bruised feeling, which is the most important hallmark of this remedy. So these are all the physical symptoms and mental symptoms in the brief of Arnica. So now the rubrics are touch aggravates, fear to touch or approach of anyone, fear generally approaching others of touched, least he be. So this is all about the Arnica. Next we are going to the Calendula, which is also another remedy of injury family. In Arnica, we can see contusions, bruises, and sore, lame, bruised pain. But in Calendula, it is little different type of pain, which is a clear-cut injury. Calendula, common name is marigold. This is proved by Dr. Franz in 1838. Miasm is acute miasm. Arnica also belongs to acute miasm. Calendula also belongs to acute miasm. The active principle, it contains traces of volatile oil, a bitter principle and calendulin, which is a tasteless substance. A most remarkable healing agent applied locally, useful for open wounds. So this is much used for the open wounds, where Arnica is for contusion, inside wounds. And this is for clear-cut wounds. And for ulcers and the parts which will not heal. This promotes healthy granulation and rapid healing by the first intention. Hemostatic after tooth extraction. Deafness, catarrhal conditions, neuroma. Pain is excessive and out of all proportions to injury. Great disposition to take cold, especially in damp weather. Extremely nervous and easily frightened. You can see in plant families, they are mostly sensitive to the temperatures. whatever happening in their surroundings, whatever changes happening in their surroundings, like the winter, summer, whatever the climatic changes occurs, they are more sensitive to these climatic changes which occurs in the environment. Similar way, Calendula, they are more disposed to take cold, especially in the damp weather. Rubrics: touch, pressure, bandages, or put on most violent pains after. Part sensitive to touch. Worst touch, pressure. So this is all about Calendula in brief. Next, we are going to deal with the next remedy, Chamomilla. We all know, and Chamomilla baby is the most important which we might have learned. In Arnica and Calendula, the injury occurs at the physical level, whereas in these remedies, injuries occurs at the mind level. So the common name is German chamomile and Marticaria chamomilla. This is proved by Dr. Honeyman in 1805. Miasm is typhoid miasm. Contains volatile oil and the bitter principle, anthemic acid and yellow occurring substance, apigenin, and in the formula and in the form of glycosoids. They are restless. Winning restlessness is seen. Child wants many things, but when it is given whatever they need, they refuses it. Piteous mourning because he cannot have what he wants. Child can only be quitted when carried about and petted constantly. Chamomilla child wants to be carried always. When they are carried only, they will be remaining quiet. Impatient, intolerant of being spoken to or interrupted. Extremely sensitive to pain. They are also extremely sensitive to pain, always complaining, spiteful, snappish, complaints from anger and vexation. Mental calmness contraindicates. Ugly in behavior, cross and uncivil, quarrelsome, vexed at triple, cannot bear anyone near him. Similar to Arnica, they too cannot bear anyone near him due to the injury at the mental level. They have aversion to being touched, aversion to talking. So due to their sensitivity and due to the injury at the mental level, they have aversion to talk. Excitement and confusion. Has no consideration for the feeling of others and will enter into a dispute or quarrel with them regardless. Fear of wind. Kicks when carried and became stew. So this is the opposite side. When they are carried, they kick. On the other side, they want to be always carried. So this is the two polarities of this remedy. Each and every remedy have their opposite polarities. Oversensitive to after coffee, despair with the pains, impatient from pain, irritability when spoken to. They are sensitive to music, to noise, violent from pain, weeping in sleep. Their characteristics are the chief guiding symptoms which belong to mental and emotional group. So as I said, there occurs the mental injury in this remedy, which may lead to this remedy in many forms of disease. Especially it is used in the disease of children where there is peevishness, restlessness, and colic give the needful indications. A disposition that is mild, calm, and gentle, sluggish, and constipated bowels contraindicates chamomilla. Chamomilla is sensitive, irritable, thirsty, hot, and numb. Oversensitiveness from abuse of coffee and narcotics. Pain unendurable, associated with numbness, night sweats. Convulsions of children from nursing after a fit of anger in mother. Cramping pain in the uterus, metrorrhagia, and difficult respiration. Chamomilla patient experiences injury from insult, humiliation, scorn, and chagrin. In turn, the Chamomilla patient's insults, injuries, hurts others and becomes rude and abusive because he perceives he is receiving injury from others' offenses. People can only give what they perceive they are getting. So whatever we think and whatever we perceive, we give it to others. So our own perception plays an important role. The Arnica montana patient responds differently from a Chamomilla patient. After an injury or many bruises, he does not want to be touched or approached. His response is to withdraw to protect himself because of his fear of further injury and hurt. So the rubrics: injuries, shock. Injuries, shock, fainting, uneasiness about heart, twitching, oppression of chest. Injuries, wounds heal readily, do not become painful. Pregnancy, infants, injuries, abrasions. Heart, hurt, sensations. Inner chest, oppression, injury, shock off. So this is all about Chamomilla in brief. So our next remedy is Taraxacum. Common name is dandelion, brewed by Somwell Honeyman, and the miasm is ringworm miasm. Depressed, constant muttering to himself, shuns labor, but after beginning works well. Inclined to talk, laugh, and be merry. Unconscious, ameliorated by open air, anxiety when sitting, ameliorated by motion, ameliorated by standing. Inclination to sit, loquacity during perspiration, restlessness on waking, unconscious while sitting. So as we saw, this is a gastric group of remedies. So Arnica and Calendula are injury group of remedies. This is a gastric group of remedy. For gastric headaches, bilious attacks with characteristically mapped tongue and jaundiced skin. Cancer of bladder, flatulence. Hysterical tymphanitis, feeling of sickness and exhaustion. Inclined to sit or to lie down. Stitching pains, jaundice, gallstones, enlarged indurated liver, generally ameliorated by walking, cramping, pain in the different parts of body. Rubrics: touch aggravates, aggravated by touch. Thigh upper part anterior stitch, pinching, aggravated by touch. We can see most all of these group of remedies of compositae family, they are sensitive to touch and they are aggravated by the touch, and they have the fear to touch because of the injury that have happened. This is the most common thing which is running behind all the remedies in this family. And the next remedy is Scnecio aureus. Common name is golden ragwort. Miasm is psychotic. They have the inability to fix mind upon one subject. These are not the persons who can fix their mind at a one particular topic or one particular subject. Despotent, nervous and irritable. We can see the irritability also in these groups of remedies commonly. And there is an alternative state between elated and sadness. Sometimes they are elated, alternatively they are sad. Excitement during menses. So this is one of the most important remedies which is used for irregularities in menses. It's a female remedy used in irregularities of menses, dysmenorrhea or amenorrhea, and metrorrhagia. Homesickness, sadness in the evening, indisposed to talk during menses, unconscious after exertion. Its action on the female organism have been clinically verified. Urinary organs also affected in a marked degree. Backaches of congested kidneys, liver cirrhosis of early cirrhosis of liver, affections of mucous gland, catarrhal conditions of mucous membrane, especially of vagina, bladder, and respiratory tract. Debilitating or vicarious discharges, tightens in the nose, throat, etc. Muscles drawn into knot. Globus, hemorrhagic tendency from organs, especially with suppressed or delayed menses. Dropsy after hemorrhage. You can see in the rubric injuries, venous section, hemoptysis. It's a single remedy. Scnecio aureus is a single remedy in this rubric. So this is all about Scnecio aureus in brief. Then the next, which we are going to see the case of this remedy at the last, so we can get much more points related to this remedy. And our next remedy is Cina maritima. Common name is worm seed or Artemisia maritima. Brewed by Honeyman in 1828. Miasm, malarial miasm. So the active principle of this drug is xanthonium, which affects powerfully the abdominal ganglia. It contains artemisia, a volatile oil consisting chiefly of phenol. So these child are very ill-humored, very cross, do not want to be touched or crossed or carried. Whereas in some child they want to be carried, but here they don't want to be carried. Abnormal consciousness, as if having committed some evil deed. Very touchy, petulant, and dissatisfied. Convulsion in children when they are scolded, because these patients are sensitive from the surroundings. So whatever the words, whatever the scoldings they get from the outside, they are sensitive to that scolding, they are sensitive to that punishment. This is the most common thing which runs in this remedy, in this group of remedies, Compositae group of family. Scolding is the main thing which runs. Children proof against all caresses cannot be quitted. Good-natured children became cross. Child carries piteously if hold or carried, lachrymose, and complaining, earnest and sensitive. Offended at slightest joke. Violent screaming, attacks at night. Child lying on back and striking and kicking with the hands and feet. Intolerance to caresses. Frightened easily on waking, fixed bedclothes, cannot bear to be looked at. Indisposition to family in children, starting from sleep, striking in children, throws things away, causeless weeping. And the characteristics are their remedy is big, fat, rosy, scrofulous children's, corresponding to many conditions that may be referred to intestinal irritation such as worms and accompanying complaints. Irritable, they are more irritable in temper. Variable appetite, grinding of teeth due to worms. Convulsions with screams and violent jerking of the hands and feet are all within the range of action. The Cina patient is hungry, cross, ugly, and wants to be robbed. Pain in shocks. Skin sensitive to touch. Patient will jump suddenly as though he felt the pain. Children stiffen out when looked at, during cough or when they became cross. Child idle restless and tosses about. Spasms due to worms, unilateral in spasm. Children throws arms from side to side. The whole body is painful, sore to motion and touch, bruised soreness. There is a gurgling noise as though water is poured out of the bottle from the throat to the abdomen. So in this also we can see the pain. Pain and the bruisedness runs throughout this group of remedies. So the rubrics are falling on account of a slight, even an imaginary insult, which indeed occurred long ago. Suspicion that he have been insulted. So these group of remedies are also act emotionally and they are very sensitive to the insult. Abusive insulting, elements from insults, offenseness, anger, irascibility. Generally, children in stiff became bent backward, thick, when carried, throw everything. They throw everything. Whatever they're getting hand, these children throw that off. Elements from scrawn, being scrawn. Elements from mortification, humiliation, and chagrin. So the next remedy is Eupatorium. Common name is Trovot and malarial miasm. So in this group of remedies, we can see the injury at the muscle level also and the injuries at the bone level. That is injury in the sense they feel the pain in the muscular level also and in the bone level also. They act best in the nervous system, and these are the remedies which can be given after the malarial fever, after a febrile condition where there is a joint pains. Ones with aching pain, sadness during the heat, mourning during the chill, known as bone set from the prompt manner in which it relieves pain in the limbs and muscles that accompany some forms of febrile disease like malaria and influenza. Eupatorium acts principally upon the gastrohepatic organs and bronchial mucous membrane. They mainly acts upon the gastric system and in the hepatic liver organs and in the mucous membrane of the lungs. It is born in miasmatic districts along with rivers, marshes, etc., and in all conditions where there is a great deal of bone pain. Cachexia from old chronic bilious intermittent, worn-out constitutions, sluggishness of all organs and functions, bone pains, general and severe, soreness, marked periodicity, violent aching, bone breaking pains. They have the violent pain which they cannot bear, as if their bones will break off. Cannot lie in bed, mourns and cries. Muscles of the chest, back, and limbs feel bruised, sore, aching. Very restless, cannot keep still, although is a great desire to do so and is not unrelated by motion. Rubrics are bones, pain, fever, intermittent. Pain, general, bones, malaria or influenza. Dullness, sluggishness, difficulty of thinking and comprehending, fever during intermittent. Aching pains as if the bones with morning. If this remedy has no curative properties other than it has for intermittent fever, it would still remain a priceless bond to homeopathy. Chasteness. Morning knowing general, chilled with. Morning knowing general, pain from. Due to the pain, the groans, the moans, shrieking, screaming, shouting. Due to the pain. And our next remedy is Abrotanum, which is southern wood, brewed by Gatchel and Dr. Deventer. Miasm, tubercular miasm. The main chemical constituent is absanthol. That is the alkaloid and it is the active principle of this remedy. These children are more cross, irritable, depressed, thinking difficulty. They will not be able to think. Loss of comprehension, inhuman. Would like to do something evil. In Chamomilla, we can see they feel there is a guilt that they are doing evil, but these children, they will do something which is evil. Peevish or despondent, alternative with excitement. Delusion hear voices in bed. Ceases when listening intently. Delusion has softening of brain. So, this remedy is mainly used in the marasmus of the children, where they start losing flesh from the, or where the marasmus starts from the mainly the lower extremities. In case of Lycopodium and Natriumur, it starts from the above downwards, but here it is from downwards to above. The losing of flesh in the marasmatic condition starts from below in this remedy, and it is one of the main remedy which acts in rheumatism. Main remedy given for rheumatic pains with alternative with diarrhea, followed by checked diarrhea. And the ill effects of suppressed conditions, especially in the gouty subjects, tubercular peritonitis. It is also used in the tuberculous conditions and the inflammation of the peritoneum. And we can see the miasm of this remedy is also tubercular miasm. So it acts mainly in the tubercular conditions. Tuberculosis and pleurisy of the lungs. and other exudative products. After operation upon the chest from hydrothorax and emphysema, the pressing sensation remains. Aggravation of hemorrhoids when rheumatism improves. Whenever the rheumatic complaints are ceasing off and the rheumatism gets cured, the hemorrhoids starts coming up. Nosebleed and hydrocele in boys. Great weakness after influenza. So it is a main remedy which is useful for the children in marasmatic conditions and in the rheumatic pains. Alternating with dysentery also, and the rheumatic pains accompanied with the hot complaints also. And in the tubercular diathesis. In females, injuries of the pelvic organs are Abrotanum, Arnica, Bellis, Perennis, Calendula, Taraxacum. We can see the whole group of remedies of Compositae family covered in this rubric. Female injuries of pelvic organs. And the mind sensitive or oversensitive to touch. We can see Abrotanum, Arnica, Montana, and Cina. Injuries, blows, falls, bruises, general. Operation disorder from chest, complete repertoire. So another one important thing which we can say in this remedy is these children like to eat boiled milk mixed with the bread. This is one of the most common desire in their food which we cannot see in the other remedies. Our next remedy is Lactuca virosa. Common name is wild lettuce, lettuce opium, and acrid lettuce. Miasm is leprous miasm. We can see the great restlessness in this remedy, ill humor with fretful peevish, disinclination to mental labor. In Arnica, Cina, and Chamomilla, we can see they are sensitive and they don't want anyone to be approached. But here, they are disinclined. They don't want to do any mental labor or they don't want to do any mental exertion, mental work because they are confused. Their power of thinking is and their power of thoughts are diminished. They have the delusion that they sees soldiers on his bed, that he would be murdered. Play antics, vivid fancies, foolish behavior, forsaken feeling. Here also they want to be, in Arnica, we can see that they want to be left alone. But here they have the forsaken feeling that they are left alone. Jumping, repulsive mood. Characteristics, this remedy acts principally upon the brain and circulatory system. Delirium, tremens with sleeplessness, coldness, and tremor. Hydrothorax and ascites, impotence. Sense of lightness and tightness affecting the whole body, especially the chest. Seems to be true galactogia. Marked action on extremities, urine smells, violets. Unusual feeling of tightness of the body. We have this unusual feeling of tightness of the whole body. This remedies helps in the increased secretion of milk. So woman after delivery, where there is no production of milk, this remedy helps in the increased secretion of the milk. So the rubrics: shock, inner chest shocks slight. The next remedy is Inula, Helenium. Common name is scabwort. Miasm is depressed miasm. So they have anxiety during menses. Characteristics is the mucous membrane medicine bearing down sensation in the pelvic organs and bronchial system are most marked. Substernal pain is used in diabetes. Sensation of someone poking a finger in various parts, especially in diaphragm. So painful, she awakens with clenches teeth, sticking pains with pins or knife. the next remedy is Lepa areata. Very important remedy in skin issues, especially eruption of the head, face and neck, pimples, acne, styes and ulceration on the edge of eyelids, profuse and frequent urination, heavy sore aching as if lying uncomfortably, numbness, lumbar region of aching points. So the rubrics: lying sensation of uncomfortably aching of the body from complete repertory, pain, sore, bruised, pain, sore, bruised, uterus jarring, sensitivity, sore, bruised joints, face pain, general touch aggravates, face inveterate acne worse by touch. So these are the above last three are the three remedies which belongs to the depressed miasm. So now the next remedy is Bellis perennis. Common name is Geysi and the miasm is cancer miasm. This was proved by Dr. Burnett. Characteristics is it acts upon the muscular fibers of blood vessels, much muscular soreness, lameness as if sprained, venous congestion due to mechanical cause. First remedy in injuries to deeper tissues after major surgical work. It mainly acts on the nervous system. So whenever there is a surgery occurs and the injury have happened at the deeper tissues, this is the best remedy to give. Results of injuries to nerves and intense soreness and intolerance of cold bathing. After gout, debility of the limbs. Traumatism of pelvic organs, autotraumatism, expresses the condition calling for this remedy. Ill effects from masturbation, excellent remedy for sprains and bruises, compliance due to cold food or drinking when the body is heated and affections due to cold winds. Externally in navel, acne boils all over, sore bruised feeling in the pelvic organs, exudations, stasis, swelling come within the range of this remedy in rheumatic symptoms. It's a principal remedy for old labours, especially gardeners. So we can see much more examples with cases along with this remedy given by the Burnett, in which at one point of time Burnett mentions that this remedy during those days, this remedy have been given mainly due to the condition when the outer environmental condition is hot and it is summer, and when they drink a cold drink, due to which the complaints are produced, which covers through the cases, most of the cases of this remedy which Burnett have mentioned. Almost of the cases which have been mentioned in the book written by Burnett. So the rubrics: female injuries of pelvic organs, Abrotanum, Arnica, Bellis, Calendula. Generalities: inflammation, surgical, Arnica montana, Bellis perennis, Calendula and Echiniaceae. Generalities: injuries, blows, falls and bruises. Operation disorders from Arnica, Bellis, Calendula, Echiniaceae and Augustifolia. Eruptions, painful touch even. Eruptions, pimples, bursting on touch. So this is all about the Bellis perennis, mainly given to the injury of the nerves and muscular system, mainly given to the remedy after any surgical procedures. So the last remedy which we are going to discuss with this family is Echiniaceae Angustifolia, which common name is purple cornflower, and the miasm is syphilitic miasm. So they are more confused, depressed and crushed. Begins anger when corrected. They do not wish to be contraindicated. They don't want others to contraindicate them. They don't want others' advice. They don't want others to correct them. In whatever things they are doing, their mistakes, they don't want others to correct them. Cannot exert mind, does not wish to think or study. Similar to the previous remedy, they too do not have any capacity to think or study. They do not want to use their mind. So we can see this remedy, this remedy belongs to syphilitic miasm, where there occurs more of destructions, and the syphilis occurs at the last stages of the life, the final stages of the death. So this remedy is mainly given in the last stages of cancer, and is mostly used in many of the blood dyscrasias and where the autoinfection occurs. So we are indebted to Alatic School for this remarkable medicine, character of blood dyscrasia, acute autoinfection, symptoms of blood poisoning, septic conditions, mainly used in these snake bites where the poison enters inside. So this remedy is one of the indicated remedy for that. Septic conditions, diarrhea in typhoid, gonorrhea, boils, erysipelas, and foul ulcers. This is used in gangrenous conditions, which occurs at the ending stage of any disease. Goiter with exophthalmic symptoms, full doses, also injections of 5 to 10 drops in thyroid gland. Tendency to malignancy in acute and subacute disorders. Last stages of cancer to is pain. Venom infections, cerebrospinal meningitis. Purpural infections, tired feeling, piles, pustules, acts on vermiform appendix. Thus have been used for appendicitis, but remember it promotes the suppression of neglected appendicitis with pus formation would probably rupture sooner under its use. Lymphatic inflammation, crushing injuries, snake bites, and the bites and stringers generally. Foul discharges with emaciation and great debility. You can see whenever there is a pus formation or suppression, whenever there is a septic conditions occurs, the discharge will be foul. So these are all the some major important remedies and of the Compositae family, and whatever the remedies which we have covered now, we have just covered the brief of the remedies. What are the important symptoms and important mental symptoms in the remedies which we have covered now? So please let know, is there any doubts up till these remedies, so that further we are going to discuss a case from this family. Is there any doubts up till now, whatever Metamerica we have discussed regarding these remedies? If yes, post your doubt in the chat box, or if no doubts, please type it as a no doubt. No doubt? If there is no doubt, we can further proceed with the case. Please let me know if there is any doubt. So, as there is no reply, I think we can proceed further with the case. So we are going to discuss a case. So it's a case of 21-year-old female with the complaints of menstrual irregularity and leucorrhea. So when she started, she doesn't started with the physical complaints. Then she is a nurse. She is studying nursing in a college, and by profession, she is a nurse. Now she is a student of a nursing college. So the case started like, tell me whatever you want to convey. I don't have any problem. I don't want to talk. So the first statement is this. I don't have any problem. I don't want to talk. We can see in this group of remedies, which we discussed prior, they don't want to be approached by anyone and they don't want to talk with anyone because they are more sensitive at their mind level. So they don't want to talk to anyone. But while taking the case, we don't know. After discussing and after analyzing this case, we can correlate the points with this family. But the case started like this. I don't have any problem. I don't want to talk. Okay, to boost up, I asked her, whatever you want to convey, you talk. I don't have anything to speak. So again, I made her comfortable, like, speak with me as your friend. She says that also, I don't speak with them more. Like how I asked her. I speak only with 4 people. I won't speak with others. We will speak about class and we will make fun of teachers. So I asked her related to fun. When she is taking class, we will speak about her and laugh. When she utters a word during class, we will use the word speak and laugh. So these people are more sensitive to what others scolds them. What are the words used by them? We can see this in the plant family. They are sensitive to the other words used by the others. Speak and laugh among us. For everything, she uses the word. So we will be like, she don't have any other work. So as well, I didn't understand. They will mock at Miss. And without listening to class, they will be laughing. Tell about that. Miss will be taking class. We won't listen. We will keep on laughing and we will get scolding. So we can see they are very sensitive to their scolding also. But we will laugh. Even because after getting scolding also, they are laughing. So I asked her the reason. She said, friends are there, it will be fun. How? Whatever happens, let it be. We should be happy. I didn't understood. Whatever trouble we face, if we see friends means it will not be shown. Whatever trouble we face, for example, if we have problem in our home, if we go to school, we'll be happy. Problems like what? Mom and dad scolding. In the teacher's area also, there we can see the scolding and they are sensitive to that. And here also we can see the scolding and beating also. Father will not beat, but mother will beat. Mother will not see when we are working, but father will scold. Sister will get beating. I will never got beating. What affected you at that time? In home, they will shout at my sister. She will shout at me. I feel sad. I will never cry even during the sadness. For example, by watching movies, some will cry. But for me, it's not like that. If there is any wound I like, I enjoy the pain. However, this is the opposite polarity of the remedy. How you are saying, if there is any wound means with pain, I like that pain. I get only laughing. That pain. How will that pain be? Burning and paining. Like both burning and paining. When fire touches, it will burn. Like that. Sister will get scolding means she won't do what is said to her. So she will get beating from mom and will be crying. So beating, we can see the common theme running in this family. I have seen in other 2-3 cases also. Because of pain, beating, and they get scolding, they get very hurt and they are very sensitive to that. So beating from others, getting from the surrounding people or their close family members is the main theme running in this remedy. How it will be when getting the beating. I feel pity. I keep on laughing. So I asked her regarding the incident. She said it happened during Pongal. Mom gave some work. She was just using mobile without doing. She got this scolding. You won't do what I tell, will sit like this only. Like that, mother scolded her. Mother will not leave. She will ask to do. I will tell her to do instead of her. So they are easily sensitive to the words, as I said priorly. So they should not, others should not use any bad words to them. Others should not speak loudly to her. So if they speak like that, it will be like an insult. Insult also is a common theme we see in this family. To others scolding or others speaking loudly, and when they get hurt, it's like an insult to them because they don't want to be touched and they don't want to be spoken by others. By seeing us, they should not laugh. She should not look at us and speak. Like what all they should not speak. The girl is not doing anything, always speaking only bad words. Like that, they should not speak because they are sensitive to what others says. In front of me, they should not speak any wrong. If they speak wrong, I will cry. In school, she is telling about the incident which has happened in the school. Once her drawing went wrong, she cried. And at that time, when they scolded her, she wanted to get out of that class at the time. At the time, she got more angry and crying comes. After crying, also anger will be there. So these both are correlated. After crying, it will be angry, so I will scold. So I asked her regarding the dream. She said she wants to be a nurse. So on the other side, she don't want to get shouting and she don't want to get this scolding. Others should not speak at her loudly. So in the same way, good nurse according to her is she will not shout at others. She will speak with them affectionately. She will not scold others. So that is a good nurse for her. We can see what they pursue from the other, but from themselves, they expect from the others. So this is the thing we saw previously. Their mind will be affected. They will like what she is speaking like, why she is speaking like this. How all they will feel. Like when we are not replying to what they have asked, then they won't come to this hospital. Should speak whatever they are speaking, we listen and reply. Should speak softly. Should not reply loudly. And this we should not speak affectionately, we should speak softly. We should not speak loudly, we should speak softly. We can also see the sensitiveness to noise also running throughout this Compositae family. So if they speak loudly means it affects. And speaking loudly is not a good way, and speaking bad words too is not a good way. And her fear is fear of dark, scared about the dark. What is the scared? That also scared that somebody will kill her. I hear the news about thieves, so I'm afraid to go out at the night. So this is all about the case where she is sensitive to the surroundings, but is sensitive to the beatings, scoldings of the others, sensitive to the noise when they speak loudly. With injuries of beatings, wounds, insult, I went into Compositae family, and whenever the insult or whenever the scolding has occurred, she comes out of that place. She comes out and she wants to come out of that. She wants to hide. So with this thing, I went into psychotic miasm. Scnecio Aureus was the remedy. Psychotic miasm, the remedy is Scnecio Aureus. One dose was given to her, and the follow-up was after 2 months. In between these 2 months, there occurred fever also once occurred. Acute complaints once occurred to her. For that acute complaints also, I repeated the same remedy, Scnecio Aureus. So this was her follow-up. Aureus was given, and we can see why Scnecio Aureus also covered. We see priorly it is one of the best indicated remedy for female complaints, menstrual irregularities. She too came with the complaints of menstrual irregularities. So have menstrual irregularities is studied in relation to young girls with menstrual irregularities. Those who have suppression of menstrual flow from getting wet, from getting feet wet, or those who have menorrhagia, copious menstrual flow which continues until they are anemic. And those who have suffered from dysmenorrhea, the pains being the most violent. In this remedy, general features, the young girl is gradually tends towards catarrhal crisis. So we can see materia medica is also covering. And the whole thing and the system is also covering. Like insult was there, scolding, beating, which we saw in the sensation active reaction of this family. In the starting. So this is her follow-up, which is in Tamil, but I have translated in sidewise and I have in English and I have typed that. So previously, she had the menstrual complaints. After 2 months, after this remedy, her periods are normal now, and leucorrhea too is not there. With this complaint, she is 90% better. She said previously when other schools or if the father says something, she used to get anger. But now that is not there. The anger is not there. If now our father scolds also, she is not that much sensitive. So this is the holistic change given by this remedy to this patient for her mental and physical issues. So whenever the remedy is selected appropriately and perfectly, it acts on the holistic sphere, both at the mental and the physical levels, and both are balanced to the patients, and we can give a holistic cure to the patient. So in nutshell, so from the starting, we saw like the introduction to Compositae family, like how, what is the name meaning, the traditional uses of the medicines from this family, were they used anciently, how they have used in ancient times, and what is the sensation of this family, what is the active passive reaction of compensation of this family.
Okay. Problem no આવે.
I request to mute the mic. Asha ma'am, I request you to mute the mic. So we saw next, after seeing the traditional uses of this plant family, next we saw the alkaloids, active reaction, passive reaction, and compensation. And we saw the each remedies, materia medica of each remedy in a brief way with rubrics and with a case study, how theory and the clinical aspect both got covered. So with this, note. I would like these results which I have brought in clinics and the level which I am today is mainly due to Sar's guidance and continuously attending Gurukul. Swara Homeo Gurukul continuously attending has made me who I am today. So I request everyone to utilize this opportunity, which is the upcoming May month from 19th to 25th. So I thank my Guru Dr. Shekhar sir, Swara family members. I thank Vidhyadeep University management for giving me this opportunity to share my experience in this platform. So thank you so much for each and everyone for patiently listening. If you have any doubts, you can put it in the chat box. Is there any doubts related to this topic? Is there any doubts? Okay, no. Thank you. So with the final note, I would like to say whenever you are reading any plant group of remedies or any remedies, read about that plant. For Arnica, read about that Arnica plant. It's botanically how it is grown in the tropical areas, and read Medica from various authors, various Medica books. So you will get an idea and we can imply in the cases. So read it from various books, various sources from internet. So thank you. Thank you all for patiently listening.